Okay, hi, my name is Steve Johnson. I'm from Atlanta, Georgia, U.S. Air Force veteran. Probably about 2 years ago, I noticed a weakness in my right arm while I was exercising. Fast forward about 4 months, I'm in front of a neurosurgeon, and he examines me. He determines that the weakness is due to two herniated discs, C4, C5, and C5, C6. I asked him about IDD therapy, and he says I'm too far gone, that I'm past that point, that my nerves are shot. And that's when I really got scared, because I thought at that point, what I thought was an option is no longer an option. With that in mind, the surgery that he was referring to is an anterior cervical discectomy fusion, where they put a 1-inch incision, they suck out your disc, and they fuse your neck, and they basically change your life forever. So with that being said, I had to seek a second opinion, because the older you get, the farther you want to be away from a knife. So I saw the second opinion. The MRI revealed the same. The second opinion was the same, anterior cervical discectomy fusion. I asked the doctor, I said, well, have you ever heard of IDD therapy? He said, no. I said, will you at least allow me to seek a non-surgical approach? He said, fine, but within 30 days, if you don't come back with, strength in your arms, flexion, extension, range of motion, we're operating. Let me just say this. I am so glad I found IDD therapy, because a month later, I came back in, and their mouths hit the floor. They could not believe that I reestablished strength and endurance, range of motion, strength, flexibility, and the atrophy that was there in terms of my muscle tone was coming back. So I just want to say that because of IDD therapy, I got my life back, and more importantly, I stayed away from the knife.